My name is Sara Putnam, and I was born and raised in Wichita, Kansas. I went to Notre Dame for my undergraduate, and then I went to St. Louis for almost 10 years, both for medical school and my orthopedic residency. Did that training at Washington University in St. Louis and Barnes Jewish Hospital. And then most recently, I spent a year in Seattle at Harborview Medical Center for a fellowship in orthopedic trauma. Orthopedics is a very, I would call it a fun specialty. It's very hands-on. We get to see the results of our work pretty quickly as patients get up and start moving again. As an orthopedic trauma surgeon, most of what I treat are broken bones or fractures, both of the upper extremity and the lower extremity, so both arms and legs. I also have a particular interest in treating fractures that extend into joints or fractures of the pelvis and the acetabulum or the hip socket. Sometimes fractures heal well, sometimes they don't heal at all, sometimes they heal in a bad position, and so I take care of those. When a patient comes in a trauma setting, if they've just broken a bone or have other serious injuries, it's a very frightening experience for them, their family. It's very confusing, very overwhelming, and a lot of times in that first situation, I find it's almost a conversation and a dialogue that you have with the patient and their family. As they kind of come to terms with what has happened, with what needs to be done, we take it on a day-by-day, sometimes an hour-by-hour basis, and taking them from the hospital and then transferring them kind of into a recovery and into a rehabilitation, seeing them in the clinic, seeing them get better. All of that is kind of a work in progress that you get to be part of. Academic medicine is a very special place, I think. It's very challenging. People are constantly questioning. People are constantly keeping you on your toes, both patients as well as their families. And we're training the next generation of surgeons, doctors, healthcare providers, and all of those patients, constantly question why. Is there a way that we can do this better? And that's a special part of academic medicine that is not present so much in kind of some other arenas. When I was 5 years old, my dad fell off of a semi that he was loading. He was a truck driver, and he shattered his hip. And he was in a hospital for a week in traction before he got a hip replacement. During that time, I was able to see kind of the impact that medicine and doctors can have on, getting a patient back up and back to their life, and I wanted to be part of that.